So my name's Helen Dugmore. I'm a senior lecturer here at Murdoch University in the discipline of nursing. My role here is the clinical and community practice lead, which means that I look after all of the clinical placements that students participate in as part of their 3-year nursing degree. So I've worked within nursing for around 27 years. The majority of my nursing career I've spent within the tertiary sector, which is our big major teaching hospitals within Perth. I worked predominantly within neurosurgery, which is a very highly specialised area dealing with the brain and the spine. And I transitioned from, and I found that I enjoyed teaching so much when I was on the ward that I transitioned into that role. Worked within education at a hospital level and then moved across to the university sector. Nursing itself provides just so many highlights. I don't think I could ever pick one moment within nursing that I have felt as it has been a moment that has stood out from any other moment within nursing. I have found every day within my nursing career quite fulfilling and rewarding, and I've always felt that there's something new to learn within nursing every day that you walk onto the ward. And that's transitioned further into education, and I just find it so rewarding now to see students learning within the clinical simulation suites and then transitioning out into placement and putting all of the skills that they've taught or they've learnt within the university out into the clinical placement area. So clinical placement for nursing students is where they get to actually go out into industry. So they go out into the major hospitals and they get to put all of the skills that they've learnt all the skills that they've learnt at university, so they get to put those into practice in the real world setting out in the clinical area. And they go out into all sorts of different clinical areas. So they'll go out into aged care, they go out into medical, surgical, community health areas, and they'll also go out into our specialty areas such as ICU, ED, HDU areas, so they're all very highly specialised areas, and they also get to work within mental health areas as well, so they cover a broad range of clinical areas when they go out there. So students go out into the clinical area from their first year, and in their first year they'll go out and they'll do a 3-week aged care block, and that's at the end of their first year. In their second year they'll do 2 4-week clinical placements, and then in their third year they'll do a 4-week block, and then they'll transition to do a 6-week, what we call a capstone unit, and that's in their final semester. And the idea of that 6-week block is to really transition the student from being a nursing student to being a registered nurse and what that role entails. Clinical placements are probably the part of the nursing course that students most look forward to. And they are so vitally important because nursing is a practice-based profession, and it's supported by a lot of theory. So there is a lot of theory that students have to understand to be able to apply their skills into the clinical area. So it is vitally important for students to be able to experience clinical placements within the first year so that they can actually apply all of that theory into their practice-based profession. So some of the skills that the students will learn out in the clinical area that are not always taught within the clinical simulation suites are things around communication. How to communicate with patients, how to develop, and we talk a lot about therapeutic communication with patients, and that's the ability to build a relationship with a patient very quickly. And that's not something we can simulate in the simulation suites because, you know, a lot of the times the students are working with each other, they have pre-existing relationships, and also we use a lot of mannequins within our sim suites. So communication skills is definitely something that they will learn out in the clinical area. How to talk to a patient, how to develop that relationship very, very quickly with the patient, so that the patient then has confidence and trust in the care that they're delivering. Students being able to go out in rural and remote placements, really, they're very, very important, I think, to the development of student nurses and transitioning into registered nurses. Rural and remote placements will go anywhere from Albany in our southwest through to the Ord Valley in the Kimberley, and these placements give an understanding of Indigenous health and the determinants of health within that community. The skills that students get to practice out in those clinical areas are they get to practice clinical skills that they'd practice down here in the metro area, but also they get exposure to things around telehealth. which is something that if you were just doing placements in the metro area, you wouldn't actually get that exposure. The nursing program at Murdoch University has just been voted #1 in the recent 2021 Good Universities Guide, and that's voted by our past students. So that in itself is a great testament to study at Murdoch University. From a personal level, I find working at Murdoch University and working with my colleagues in nursing is an inspiring and very supportive environment. All academics within nursing have an open door policy for students, so students are very well supported. Students are put into the clinical simulation suites within the nursing program from the very first semester. From their very first week, they get to start practicing their skills to be a nurse. So the facilities here at Murdoch University are world class. We offer simulation suites at both our Perth and our Mandurah campus. They have we use a range of simulation, high fidelity and low fidelity simulation to support students in their learning. At the bedsides we have monitors so that students are able to practice electronic record and utilise and understand electronic record, which is something that they will use out in the clinical area. We also use a digital platform for assessment of students, and that digital platform is called PebblePad, and that's integrated across our curriculum from our theory units to our simulation suites and out into the clinical area. What's really important, I guess, around that digital platform and also using the monitors at the bedside and electronic record. So we're equipping our students with the digital literacy that they're actually required to have working within the health industry. When I have the opportunity to come into the simulation suites and I see the students learning at the bedside, I find that so rewarding, because these are the people who are going to carry on my profession, the profession that I'm incredibly proud of and incredibly passionate about. When I go out into the clinical placement areas, when students are on placement, I actually see them putting those skills that they've learnt at university into practice at the bedside with patients. And when I see that light bulb go off in a student to think, oh, that's what I learnt at university, I'm actually seeing that. You know, I can actually see the link now between what I'm doing and what I learnt. They're the moments that I find most rewarding. They're the moments that keep me going forward in my profession and, you know, get me up in the morning and get me excited to come in to teach students. Employment prospects for nursing graduates is very good. Within the health industry, we have a lot of different opportunities available for nurses. There are specific graduate programs which are available through a lot of our major tertiary hospitals and a lot of our private hospitals, and these are supported programs that see students transition through their first year as a registered nurse. But there are also many other opportunities available for students. So aged care is actually an industry which employs a lot of registered nurses in their first year. They often offer a lot of support programs to support nurses in that first year. The role of the nurse in aged care is actually very, very different to the role of a nurse within the tertiary hospital. There's a lot of leadership and delegation and organisational knowledge and behaviours that a newly graduated registered nurse with an aged care needs to have. There's also a lot of roles available within the community area, within primary health areas. And for those students who love our rural and remote areas, there is so many opportunities within those areas. I guess the advice I would give to anybody considering doing nursing is not to consider it, is to actually go ahead and do it. It has, as I've said before, has been one of the most rewarding things that I've done. It's the best thing that I've done in my life, really, and it's given me a career that has been very, very rewarding and still continues to challenge me and reward me every day.